So yeah, my name is Bruce Suchland. I'm a nurse practitioner. Been doing it for, 12 years now, so I love it. Well, so back in high school, I blew my knee out and got to know the athletic training and physical therapy world. So after that, I decided to get into athletic training, and I loved it. The only problem I had with athletic training is we did a lot of time spending just sitting and waiting for something to happen, right? Waiting for an injury. And I kind of wanted something a little bit more, run and gun kind of thing. So I decided to get into ER nursing, and so really enjoyed, the buzz of that. But then in the emergency room realized like it's too late at this point, right? That these people should have been helped sooner, that so much of this could be prevented and taken care of before it happened, right? And so I looked at family practice as a way to intervene, right, before the illness or before the accident or before things got so out of control that the ER was needed. Really, I think, traditional healthcare has its ups and downs, and sometimes it seems like, again, we're reacting to illness, right? So even in family practice, we were waiting for illness to happen more and more as the years go on. And so the idea to me behind a direct primary care and a true preventative situation, right, is we get to intervene before, right? And so it's just going further up that timeline and trying to find a way to prevent it before we even realized it was ever going to come. Anything outside, really. So I like to drag the kids out, or they'll drag me out. We'll throw baseballs or softballs or shoot baskets out in the yard in the driveway. We like to hunt, we like to fish. My son loves to do both. My daughters, they're kind of back and forth, so. But yeah, we like to just be out, really. Sitting down on the couch at the end of the day is fun, but during the morning and the afternoon, it's like, let's just go do something, Yeah, so it's hard to pick one, right? Because we grow so close to so many people. But I had one patient, and just knowing his family, we had all of his family. He was, in his 50s. He had brothers in their 60s, and his sister was in her 40s. And we looked at, their family history, and 3 of them had heart attacks, and 3 of them had diabetes, and 3 of them had high blood pressure. And he was in pre-hypertension, and he was in pre-diabetes, and we knew kind of where things were going to go for him. And so we just really, got aggressive and intervened, and still to this day, he's not progressed to type 2 diabetes or high blood pressure, and he's still doing well, despite all of that family history and the genetics and the environment. So really, it's connecting with people. I love it when we can do something that makes somebody smile in whatever way, whether it's a mental health issue or a physical health issue, when you can put something away for people and make them feel better and get that smile and just feel like you're doing something to brighten their day. I think sometimes people don't realize how much that makes my day better, right? So they think, oh, he's doing a good job trying to make me feel better, and really it makes me feel better that I've accomplished something, or that I've impacted somebody's life in a positive way. Yeah, I think every company, every health plan that you work with presents its own challenges, right? And so anytime that you can get to know a health plan and understand, what the benefits are to that health plan, and how are we going to make this work, what medications are going to be covered, or what types of things we're not going to be able to do. It's good to become so familiar with a group that you can drive the best benefits for that employee and their health plan, and not overspend or undertreat or underprevent or anything like that. Yeah, so when I first started in medicine, I probably was not in the best space myself as far as my faith goes. And so for me, it's been quite the journey over the last 20 years, going from never thinking or talking about my faith in an exam room to just being open and honest with people about it, and just really seeing where they're at in their faith, and then trying to help utilize that to help deliver the best care for them, and not trying to ignore such a large part of their life because it's not okay to bring up, or it's it's bizarre to talk about, or just feels different to talk about. So just bringing it up, seeing where they're at, seeing how that plays in with everything else, it's a big piece of the puzzle, and I like to not ignore it.